Welcome to Cardiac Rehab. My name is Kevin Minchin, and I will be the physical therapist taking you on your journey today to an evaluation assessment of your heart condition, impairments, and goals. Please take the time to listen to this audio presentation that will answer many of the questions that you may have about what is going to occur today, what cardiac rehab is, why we are here, and how we can help. We look forward to meeting you, and again, thank you for taking the time. At this time, I want to go over the few main diagnoses that we see here as a referral source. It may be referred from the physician, or you may have asked your physician for cardiac rehab due to one of the following. The most common diagnoses that we see are coronary artery bypass graft, as depicted in the picture. Another very common diagnosis that we see here at this facility is the stent placement. Although less invasive than the open heart procedure, equally as important is the recovery process and the time at rehab. The third diagnosis I wanted to discuss today was the valve replacement. Depicted in this picture is a mitral valve replacement. However, we also see aortic valve replacements commonly. And again, we will discuss any questions you have regarding this diagnosis in a few moments. For a pacemaker or defibrillator surgery, which helps to control the rhythm and rate of the heart to make sure you're safe at all times. If any of the four preceding diagnoses was not something that you underwent, don't worry. Doesn't mean you're in the wrong place. There are plenty of other things that we will work with here, including arrhythmias, cardioversions, ablations, shortness of breath symptoms, and general maintenance of malaise conditions to prevent further or potential cardiac complications. At this time, I want to go over a few of the most common questions that we get early on about cardiac rehab and what it entails. The first question that we often get is, why do I need the rehab process if the surgeons have gone in and fixed the problem and I don't feel the same symptoms that I felt leading up to my heart attack or my chest pain or those same symptoms? In this case, I like to compare it to a simple analogy. When we look at infrastructure in society, let's say that we have a riverbed, and when the goal is to cross that riverbed. So then engineers and construction workers go in and they create a bridge that allows us to pass over that riverbed. In this case, yes, the initial impairment of not being able to go over the river has been resolved. However, there's going to be a lot of tests and measures to make sure that this bridge is safe along the way. We want to make sure that we can adequately cross the bridge without any collapse or without any unsteady or instability. So similarly with our heart, okay, the surgeons went in and they fixed the problem in many of these cases, either by inserting a pacemaker or inserting a stent or the open heart procedure. In those cases, we want to make sure that the vasculature nature, the proper blood flow throughout this bridge, if you will, in this area of impairment is flowing smoothly and adequately and efficiently without any complaints of chest pain or any abnormalities on our monitors. So why are we at rehab after we feel okay? We want to improve that endurance, and we're going to give you a case example of why we feel it is most important. The second most frequent question that we get right off the bat is, why did this happen? Do we know what occurred and why it happened to me? And we cannot pinpoint this exactly what happened, but when we look at this hand, we can get an idea of maybe areas of weakness within our life that we can improve upon that may have led up to a blockage in the heart, or a need for this open heart procedure, or just the symptoms of chest pain and shortness of breath. The first thing we want to consider and look at is our overall activity level. Okay, we don't want our blood to stay stagnant within our body. We want to see it rise up, raise our heart rate, and then recover quickly. Second being proper nutrition. Okay, society often trends towards a diet that is high in fast foods, frozen foods, sodiums, and cholesterol. We want to make sure we have a good handle on our diet. The third being stress. That is often called the silent killer because it's something that often goes unrecognized. Okay, we want to make sure we are in a good mental state, understand our mental health, understand areas where we need assistance with, and time throughout our day to kind of relax and take away from the stress of life and just enjoy life. The fourth being smoking, for what some may consider obvious reasons, and its detriment to our cardiovascular system. And the fifth being alcohol. Even with all of this said, let's say we have a good grasp and good hand on all of these, we still have to consider what we see down here at the wrist, our genetics. Okay, so we want to make sure, even if we've been dealt a bad hand with genetics and maybe have a family history of requiring stents or open heart procedure or whatever it may be, we want to make sure that the fingers do not lead into and assist. If we have poor nutrition, high stress, well, that may make our condition worse. So we want to be aware of these things and try to make the proper adaptations when necessary. In a few brief moments, we will be grabbing you to bring you back for your first official visit. And when we do so, we are going to hook you up to one of our heart monitors, which will entail us putting 3 electrodes onto your skin, which can be depicted here in this picture. We will place one right by your left shoulder, one, the white electrode by your right shoulder, and the final electrode, the red electrode, on your lower abdomen, just above your belt line. These 3 electrodes will be placed on all visits at all times to make sure we are safe throughout our time here. What these pictures will allow us to do is to look at the rhythm of your heart. I will show you an image of the rhythm of your heart today. We can go over maybe some areas that we may focus on and try to analyze and make sure that your cardiologist and your medical team is aware if necessary. We want to correlate how you feel to what we're seeing on our monitor. So in this instance, we can measure the heights of the waves, the distance between waves, make sure we're not going into any arrhythmias or anything that is not previously known about your history. We want to make sure we're staying in a stable condition while we're going through activity and raising our heart rate and watching it properly recover. We will analyze these with our team. Again, my team consists of myself, the physical therapist, the nurse, a respiratory therapist, a physical therapist assistant, and some techs and aides that will assist us along our journey in the rehab process. One of the major ways that we measure your progress through rehab is by looking at this chart here in this zone of intensity of our heart. Very often, right after a procedure, leading up to a procedure, we live in a more sedentary lifestyle. So when we're looking at our zones, we're used to living and hanging out in this zone 0, this white zone. And what that means is that our heart is functioning at an intensity of between 0 and 39%. So maybe when we're going grocery shopping or doing the lawn, we may raise our heart rate a little bit, but maybe it's at 20%, 25%. What we want to see is that we can raise our heart rate intensity through rehab, through the purple, gray, blue, and up to the green zone. We're not going to try to hit the yellow and red zones. Those are for more of the high-level athletes and high trainings. But here what we're looking at is challenging your heart to see how it adequately works at these upper zones, and then letting you rest and recover and watching how quickly your heart rate can come down. So research out of the Cleveland Clinic in Ohio is showing that a recovery rate of 20 beats per minute is the golden number we're looking for. We will do a few tests on you today. The reason we feel this zone system is very important is if we go about our day-to-day life in a white zone, okay, with low intensity, and then one day we get stressed and have to run around to catch a taxi or something, and our heart rate spikes into a zone that we are not used to, let's say the blue zone, we have a higher chance of undergoing complications, a heart attack, the misbeat, a murmur, and arrhythmia. However, if we slowly build our cardiac strength up into these zones where we become used to and it becomes a part of our daily life, our heart is in better condition, we'll have a better recovery and a better outcome. I think it's very important in this time for us to go over the graphs that we're going to perform on you today so you feel comfortable when we go through this process. I'm trying to explain these quickly. We want to compare a previous patient case for their first visit to their last visit. We'll do the same assessments on you today. We're going to look at 3 things, okay, and they're depicted on these graphs by the hearts. Position A is the resting heart rate of the individual. Position B is the peak heart rate performance on one of the 4 tests that we will do today. While position C is the rate of recovery while you sit down and rest for 1 minute after you reach your peak performance. So 2 things we're looking at and allow us to calculate is what intensity is your heart rate working at. So with this individual, on their first visit, their heart rate was working on the white zone, which is depicted by the white graph line. The goal for their rehab would be to get all the way up to the green zone, which is depicted above it with the stars. Most importantly, when we do reach that peak performance, we want to see how fast does your heart rate recover. In this instance, from position B to C, the recovery rate was 10 beats a minute. And again, we're looking for the golden number of 20 or more for many cases, which would be depicted on the teal line. So we can see some areas of improvement in this graph. We would prefer that white line, by the time rehab is done, to climb up to the green line and see a faster recovery of the heart. In just a moment, we're going to look at how this data looked on the patient's last visit. This again is that first visit data, and again we can see we started in the white zone with an intensity of 37%. When we assess this patient's final visit data, we can look at those 3 hearts again and start to see some improvements. Position A, the resting heart rate stayed the same, which is common and expected. Position B, their heart rate had a better ability to climb up higher, which is why their graph is closer to that green line and correlates to them being in that blue zone. This will often come with symptoms of improvements in shortness of breath, able to do more in their day-to-day life, just overall endurance improvements. And then when we look at position C, the rate of recovery, this patient had an improved ability to match that teal line. Their recovery rate was now 25 beats a minute, which shows improvement in endurance of the heart compared to their 10 on their initial visit. This here is another way of looking at that last visit data, and as we can see on the last visit for this patient, their heart rate had an improved ability to climb to those higher intensities in the blue zone. When we go back and compare this data from the first visit to the last visit, which we love to show the patients and ask them how they're feeling and then correlate this to the graph, we can see that at position B, the patient had an improved ability to reach that higher intensity without any complaints or setbacks, coming from the white zone to the blue zone. And in position C, they had an improved recovery. They are now below the teal line. With overall, the improvements of rehab are both shown here and would be reported by the patient. Thank you for taking the time to listen to this audio presentation and demonstration. At this time, if you could please pass the tablet back to the receptionist up front, and then we'll be up shortly to grab you and get started on this journey of cardiac rehab, perform these tests, and answer any remaining questions that you may have.